if the public has contributed through higher deductibles and that sort of thing, might that be part of the slowdown itself? In other words, if people have more skin in the game, if they're paying more, maybe they're using less. I mean, is there any evidence to support that?
Yeah, I mean, there is evidence to support that. And I do think that that is one of the factors explaining some of the slowdown in the growth of healthcare costs over the last 15 years, because at that time, you have had a pretty noticeable increases in deductibles and your share of premiums, even if you get your health insurance from your employer. And that does lead to lower healthcare spending. The big problem here, Bob, is that this idea of skin in the game, of us having to spend more out of pocket, so we're more hesitant to spend on healthcare, is sort of fundamental economic logic. Yet there is no logic to how people choose to do that healthcare spending slowdown. There have been lots and lots of studies that we just aren't equipped as individuals to know when is the right time to spend money on healthcare and when is not the right time to cut our healthcare spending. And we also have very little information on cost and quality to make those decisions. So while it is true that we spend less on healthcare when we have more skin in the game, it is not true that we kind of are making the right choices in the healthcare market to have that happen.
Yeah, it's kind of a blunt instrument, and there are so-called shoppable services and some things that aren't shoppable that consumers, as you say, just don't have the information or the availability of choices.